The title of today's lecture is Recognizing Signs and Symptoms, and in particular, what are the signs and symptoms and the things to look for to recognize whether or not you have heart disease. One 15. In today's lecture, we focus on the symptom of angina. What is angina and what are the underlying causes of angina? Recall that there are a group of risk factors that cause damage to the artery wall, and there are a group of risk factors that cause increased amounts of LDL cholesterol that circulate by those walls. So as the circulation of LDL goes by those damaged walls, they have a tendency to stick on, start to narrow down. That's the process of atherosclerosis. Once they narrow down, they decrease the amount of blood flow and therefore oxygen that reaches the heart muscle. So when we couple the increased demand of the heart to perform activities with the decreased availability of oxygen, we result in having heart pain. Some of the things that are extra work or increased demands to the heart would include exercise or physical activity in general, eating and digesting a large meal, exposure to heat and cold, or being under a stressful situation. All those things increase the demand of the heart muscle, requiring more oxygen, yet the heart muscle has less available oxygen. That temporary lack of oxygen causes pain to the heart, and that's the process and definition of angina. One 16. As we examine the classic symptoms of angina, we know that they affect people in different ways. The intensity can vary, the location can vary, sometimes they're predictable and sometimes they're not. So what are some of these classic symptoms of angina? Most people have a squeezing chest pain type of pressure. Some people can have shortness of breath with that or as a symptom alone. Sweating, chest tightness and discomfort, a general tiredness, pain that spreads across the shoulder blades or up into the neck or arms, indigestion burning or gas-like pains, dizziness, nausea, or vomiting, just general weakness and fatigue. A lot of these are very common ways that people experience angina. A lot of times there's a difference in the way that women and men experience angina. So anytime that you have a pain that is in any of these categories, it's unexplained, different than normal, it's recommended that you go in and get checked out by your doctor to make sure it's not angina pain. And if it is angina pain, what can we do about it? One 17. During the doctor visit, you're going to report in detail the symptoms that you're having to determine whether or not those are angina pains and whether or not there's underlying atherosclerosis. So the doctor is going to ask that you describe in detail what type of activity brings on that pain. Is it exercise, activity in general? Does that pain follow a large meal or when you're stressed out? Does it wake you up at night? How intense is it? Can you do things to relieve those symptoms? Can you take a nitroglycerin tablet if you've been prescribed one and it helps the pain or it does not? He or she is going to determine what kind of diagnostic test that's appropriate to determine what's going on that causes those symptoms. They can often start with a 12-lead EKG that's resting. If something abnormal shows up on that 12-lead EKG at rest, a treadmill test often follows so that your heart can be looked at under stress. In addition to looking at your heart under stress with an EKG during a treadmill test, you can be injected with a dye, and following that test, they can watch the pathway of that dye to see, in fact, if you have blockages, letting them know whether there's a process of atherosclerosis there. Other tests that can be administered are CT scans, PET scans, and all those things show metabolic changes in the tissues and the blood flow. Lots of those things can be administered. In addition to that, you can have a heart catheterization to see whether the coronary arteries are blocked or narrowed, the process of atherosclerosis, where and how much, and then it can be determined as to what procedure needs to be administered to correct the problem. (118) Following the diagnostic testing is going to be the application of the appropriate procedure to address the underlying problem. An angioplasty procedure is used to open up a narrowed or blocked artery that supplies the heart. A stent is a small metal mesh tube that expands inside the coronary artery to hold open that narrowed artery. In more difficult cases, it may be that a cutting balloon procedure is used to apply small cuts to the artery during inflation to make sure that there's less disruption to the plaque, making that less of a risky procedure due to that buildup of plaque. Permanent pacemakers can be applied for arrhythmias. Defibrillators can be added to the pacemakers in case of defibrillation problems due to those arrhythmias. Coronary artery bypass procedures may be applied if the artery cannot be stented and you totally bypass that artery through the coronary artery bypass grafting procedure. A maze procedure is used to treat atrial fibrillation, creates a pathway of scar tissue to direct the electrical pathway of the heart contraction. An ablation destroys the scar tissue damage that is allowing an abnormal electrical pattern of the heart contraction to occur. Maybe that a valve is not properly opening and closing, regulating the amount of blood flow that is necessary to be healthy for the heart and body. Maybe that we add medications to all of these procedures, and those medications, as you recall, are the glucosides that can increase the ability of the heart muscle to contract properly and decrease heart arrhythmias. ACE inhibitors open up the blood vessels and decrease the workload of the heart. Diuretics decrease fluid and sodium throughout the cardiovascular system. Beta blockers decrease oxygen requirement of the heart and decrease the blood pressure. Nitrates dilate the heart arteries. So the medications, in addition and coupled with the proper procedures, are going to decrease the symptoms, address the underlying problems that we're having with the cardiovascular disease. (130) Summary of the medications used to treat heart disease and heart failure. Cardiac glucosides increase the ability of the heart muscle to contract properly to prevent heart rhythm disturbances. ACE inhibitors, they're going to open up the blood vessels and decrease the workload of the heart. Diuretics help rid your body of fluid and sodium. Beta blockers reduce the oxygen requirement of the heart and also lowers blood pressure. Nitrates dilate the heart arteries. The takeaway: start keeping an angina log. That means we need to time and date what we're doing when the angina starts, what triggers it, how severe is the pain, how long does it last, and do you do anything, if anything, to manage it. Keep that in a log, present that to your doctor so that it includes your questions and concerns to discuss with he or she. In addition, track your personal risk factors as always. Those risk factors are smoking, stress management, controlling your lipid profile, your blood pressure, diabetes, keeping your weight under control, and including your physical activity by starting your exercise program. Know the ideal healthy ranges and track your progress of controlling these risk factors. Along with your lifestyle changes, you're learning and making these choices. It's very important to continue taking all your medications until your physician takes you off of those. Your medicines, recall, assist in improving blood flow, lowering blood pressure, managing cholesterol, and regulating heart rhythms. So don't take yourself off of the medications because you think you'll feel better or you temporarily do feel better. They're very important in the process of keeping you healthy as you control your cardiovascular disease.